The patient wants to increase the upper and the lower lip. In this case, an augmentation of the projection and volume of the lips is indicated in order to improve the aesthetic aspect. Furthermore, a depression of the tip of the nose is present due to a previous trauma. We start with a disinfection of the region to be treated and an application of a thin layer of fast-acting anesthetic gel, which within a few minutes significantly reduces the sensibility of the skin and therefore the sensation of pain at the moment of penetration of the needle. We now proceed with an accurate disinfection of the region to be treated, first with a disinfectant soap and then with an alcohol-based disinfectant. We now insert the needle transcutaneously on the border of the vermilion until reaching the subcutaneous level, where Aquamid is to be implanted, without penetrating the muscular level. In order to check that the needle is in the premuscular level, above the muscle, we can perform a simple maneuver by pressing the muscular level with the needle. The inferior profile of the orbital muscle will be visible, and at the same time will provoke a retraction of the surface of the vermilion. We can now start the injection in a retrograde manner by injecting thin parallel lines of Aquamid with a back and forth movement, always in the premuscular level. It is recommended to start the initial phase of filling very slowly in order to diminish the painful feeling provoked by the expansion of the tissue. We can now proceed to inject more fine lines of Aquamid in the region behind the muscle by passing the needle to the submucosal level. By palpitating the mucosa, we can identify the presence of the needle in the submucosal level. The transcutaneous method used for the filling of the submucosal area, although a little more complicated than the transmucosal method, avoids needle penetration of the mucosa, which normally contains a lot more bacteria. The augmentation of volume in this region, which normally abuts the teeth, will give an augmentation of the projection of the upper lip in an anterior way, while conversely an implantation over the muscle, as previously carried out, has provoked a rotation forward and upward, and therefore an eversion of the vermilion, augmenting the height and making it more evident. We complete the filling of the upper right part of the lip by injecting near the border of the mouth and continue the filling with more thin lines of Aquamid both at the premuscular and retromuscular level. With a delicate palpation, we can verify that the position and the volume of the implanted material is symmetric and sufficient. We note that immediately a light degree of oedema is present due to the trauma of the skin, provoked by the needle and the expansion of the tissue. We therefore have to keep the volume of the injected gel in one half of the lips as a reference in order to reproduce the same level of augmentation in the other half of the lips. If you only consider the appearance of the volume, it will induce a hypercorrection with consequent asymmetry. We now proceed with the inferior lip, which also has to be corrected in order to fit the augmentation of the superior lip. We have to remember to keep a well-defined aesthetic correlation in form and volume between the superior and inferior lip. The inferior lip should be slightly more voluminous than the superior lip, while the superior lip should have an identical or even slightly bigger projection than the inferior lip.